When a serious injury occurs, you have to think and act quickly. Medical assistance may only be minutes away, but sometimes seconds count. What you do in those first few seconds and minutes can make the difference between life and death. Quick, calm, and correct action can make all the difference. First aid is emergency care given to the sick or injured before medical personnel arrive. That's why a knowledge of first aid and CPR is so important. And that's also why you're here participating in this session today. The purpose of this session is to provide you with a basic overview of first aid techniques and priorities. It is not the same as a first aid and CPR certification course. A certification course is much more detailed and offers you the opportunity to practice first aid and CPR skills, as well as to provide you with hours of classroom training. We do urge you to take a course and get certified. Taking a certification course will give you the full knowledge and confidence you need to use first aid skills on the job, at home, and elsewhere in your community. The main purpose of this session is to provide you with basic first aid procedures. By the time the session is over, you should be able to recognize the benefits of obtaining first aid and CPR certification, identify proper procedures for a variety of medical emergencies, assist in administering first aid when a coworker is injured, and to do no further harm. Before we get started, let's see how much you already know about first aid. Decide if each of the statements on the screen is true or false. After an accident, immediately move the victim to a comfortable position. This is false. If a person is bleeding, use a tourniquet. This is also false. Signs of a heart attack include shortness of breath, anxiety, and perspiration. This is true. And finally, all burns can be treated with first aid alone. No emergency medical attention is necessary. This is false. So how did you do? Did you get all of the answers right? During today's session, you'll learn more about these first aid issues and a lot more. Just imagine, a coworker is hurt in an accident and blood is gushing from the wound. One of your friends chokes on a piece of food and cannot breathe. Just imagine someone goes into cardiac arrest right at their workstation. Any one of these things is possible, and it could happen anytime. If it did, you would have to act fast. A few critical moments, one way or the other, could make the difference between life and death. Would you be ready to act with speed and competence in a workplace medical emergency? There are medical emergencies in the workplaces around the country every day. Situations calling for first aid range from burns to cuts and amputations, eye injuries, chemical overexposures, and much more. Do you know how to report a workplace medical emergency? Besides calling 911, you should also notify a supervisor or manager and provide as much information as you can about the accident. Every medical emergency is different, but there are 4 basic rules that apply to all medical emergencies. 1. Call for medical help immediately. An employee on the scene should call 911, while another certified in first aid and CPR tends to the victim. If you make the call, explain the kind of injury and where the victim is located. 2. Bring help to the victim. Don't bring the victim to help. In other words, victims should not be moved unless they are in imminent danger where they are. 3. Check the ABCs. A stands for airway, B stands for breathing, and C stands for circulation. That means to make sure that the throat is clear, the victim is breathing, and the victim has a pulse. A first aid certified employee may be called upon to perform rescue breathing or CPR to keep the victim alive until EMS personnel arrive. And 4, do no further harm. This means to be careful not to cause additional injuries in your attempt to help a victim. When it is clear that a victim's condition is immediately life-threatening, such as choking or not breathing, perform first aid immediately. When the situation is not life-threatening, there are multiple injuries, or when there are multiple victims, take a few moments to assess the scene to make sure it's safe for you and other helpers, and to be certain you know what type of first aid is required. Always evaluate the scene for number of injured and nature of event. Assess the safety of the scene, including the potential for toxic vapors or gases in the air and other risks such as electrical or fire hazards. Prioritize care when there are several injured. Check victims for medical alert tags. Perform a logical head-to-toe check for injuries. And move the victim only if absolutely necessary to prevent further injury from a hazard at the scene. For those of you attending today, do you know which of your coworkers is certified in first aid and CPR? You should call a trained person to the scene whenever there's a situation you cannot handle yourself. Now, let's look at some specific medical emergencies. We'll begin with no breathing. When a person is unconscious and not breathing, irreversible brain damage occurs within 3 minutes. You have to act very fast. Someone trained in CPR should lay the person on his or her back while someone else calls 911. Loosen the clothes around the neck and make sure nothing is blocking the mouth or throat. First, give 30 chest compressions by placing both hands in the center of the victim's chest with one hand on top of the other and pressing down with the heel of your hand 1.5 to 2 inches. Press quickly at the rate of about 100 compressions a minute. Next, open the airway by tilting the head slightly back and lifting under the chin. Do not move the victim's head back if you suspect a neck injury. Form a seal around the mouth and pinch the nose. Use a pocket mask if you are trained in its proper use. Breathe 2 slow breaths into the person's mouth, enough to make the chest rise and fall. Then continue chest compressions. Once you begin CPR, continue until EMS personnel arrive. Heavy bleeding is another serious medical emergency. If a coworker is bleeding heavily, you have to stop the flow of blood while you wait for EMS personnel to arrive. Because of the risk of bloodborne diseases, you must wear gloves, preferably from the first aid kit, when administering first aid for the bleeding. Next, cover the wound with a clean bandage from the first aid kit. Then apply pressure with your hand directly over the wound. Do the same thing if a finger, hand, or other body part has been amputated. While you are applying pressure to the wound, have someone else place the amputated part in a plastic bag with ice. Make sure to wrap the severed part so that it doesn't directly touch the ice. Give the package to EMS personnel or rush it to the hospital. In many cases, severed limbs can be reattached. Do you know where the nearest first aid kit is located in your work area? If you're not sure, please get with your branch safety representative or call me. We will help you. In cases where a person has lost a lot of blood, a condition known as shock can develop. Shock is the body's way of reacting to severe injury. A person in shock may appear stunned or confused. To treat shock, lay the victim down, cover the victim to keep him or her warm, and raise the feet slightly above the heart level. Another type of shock is called anaphylactic shock. Anaphylactic shock is a severe allergic reaction to insect bites, medicines, or certain foods. Symptoms include hives, overall weakness, and swelling of the throat. Steps to take if a person is in anaphylactic shock include asking the person if they have medication. If so, give it to him or her right away. People with severe allergies also usually wear a medic alert tag, so look for that. You will need to give EMS workers all the best possible information. Anaphylactic shock can be deadly, so call for help fast and be prepared to start CPR. Signs that someone is having a heart attack include shortness of breath or difficulty breathing, anxiety, pressure, squeezing, fullness, or pain in the center of the chest, radiating down from either arm or in the jaw, ashen color to the skin, and perspiration, nausea, or vomiting. First aid for heart attack symptoms begins with calling 911. Then make the victim comfortable, either lying down or sitting. Loosen tight clothing at the waist and neck. Ask the victim if he or she has heart medication. Do not let the victim move around. And finally, don't give the person any stimulants like coffee or tea. If the heart stops beating, begin CPR. However, if the heart is beating and the person is breathing, CPR is not necessary. Just keep him or her comfortable until EMS personnel arrive. A person can choke to death in a couple of minutes. The fastest way to find out if someone is choking is to ask, "Are you choking?" If the person can cough or talk, he or she is not choking. But if the person cannot talk or cough, you should first deliver 5 back blows between the person's shoulder blades with the heel of your hand. If the back blows do not clear the object from the throat, perform abdominal thrust. To do this, you would stand behind the victim and wrap your arms around the waist. Make a fist with one hand. Place your fist thumb side in against the victim's stomach, above the navel but below the ribs. Grab your fist with your other hand. Pull in and up sharply and repeat if necessary to dislodge whatever is stuck in the throat. Repeat the sequence of 5 back blows and 5 abdominal thrusts until the object is cleared. Do you know how to perform abdominal thrust? Everybody should. It's simple and it can save a life. If the sequence of back blows and abdominal thrust does not clear the object and the victim becomes unconscious, call 911 and follow their instructions. If you cannot speak with anyone, try a finger sweep if the object in the throat is clearly visible and accessible with your fingers. Use gloves if possible. Use your index and middle finger to grasp the object. Do not try the finger sweep if there is a chance that you'll push the object further down the throat. Lay the person down on his or her back and perform 5 abdominal thrusts by placing your hands one on top of the other and push the heel of your hand in and up sharply on the abdomen just below the rib cage. Once the object is cleared, check the ABCs, the airway, breathing, and circulation. If the person is not breathing, perform CPR until medical help arrives. The first rule of dealing with electrical shock is to not touch a person who is in contact with a live electrical current. If you do, the current can pass right through the person to you and cause the same injury. So the first thing you should do is turn off the power to the electrical equipment involved. Then call 911. Electrical shocks can be life-threatening. You want to get EMS personnel on the scene quickly in case the victim has stopped breathing. If you have to remove a person from a live wire, be very careful so you don't get a shock too. Stand on something that's an insulator, like a rubber mat. You should wear rubber gloves. You could use a dry stick or wooden broom handle or a board to push the person away from the wire. Do not use anything metal, wet, or damp. Once the victim is safe, check for breathing. Begin CPR if the person is not breathing. Now here's a matching exercise to see how much you remember about the first aid procedures we've just described. Your branch safety representative should have given you a hard copy of this as well. In column 1, you will see a list of medical emergencies. In column 2, there is a list of first aid procedures. See if you can match the problem with the correct first aid procedure. Okay, so here are the answers. Bleeding goes with direct pressure. Choking goes with abdominal thrust. No breathing goes with CPR. Heart attack goes with keeping the victim still. And shock goes with elevating feet. How did you do? Did you make all the right matches? Now it's time to ask yourself if you understand all the first aid information we've presented so far. Be sure you understand the first aid procedures for no breathing, bleeding, shock, heart attack, choking, and electrical shock. It's important to understand all this information because any one of these medical emergencies could occur in the workplace. Eye injuries are a common workplace medical emergency. Eye protection can prevent most injuries, but just in case, you should be familiar with first aid for different types of eye injuries. For chemical splashes, flush eyes for at least 15 minutes with water and then close the eyes and cover them with a clean cloth. You should get immediate medical attention. For solids, such as dust, particles, or powders in the eye, flush with water until the particle comes out. If it won't come out, cover the eye and seek medical attention, and remember to not rub your eye. For a blow to the eye, apply cold compresses for 15 minutes to reduce pain and swelling and get medical attention. For cuts near the eye, bandage loosely and seek medical attention. Again, you should not rub your eye. For objects that penetrate the eye, do not try to remove, move, or put any pressure on the object. Immobilize it by placing a paper cup or soft, bulky dressing around it. Secure with tape. Bandage the other eye so that the victim will keep the injured eye still. Get medical attention immediately. Burns are another common workplace hazard. You can be burned by hot surfaces, hot materials, or by the properties of certain materials. First aid for burns depends on the degree of the burn. First-degree burns are the least severe. They just involve the top layer of skin, which become reddened and painful. Second-degree burns are more serious and include blistering in addition to reddened skin and pain. First and second-degree burns may be treated with cold, running water for relief of pain. Then cover the burned area with a moist, sterile dressing. Don't break blisters on the second-degree burns. Third-degree burns are the most serious and can even be life-threatening. With the third-degree burns, the skin is destroyed. You will see charring and deep tissue damage. You may even see exposed bones. For third-degree burns, call 911 immediately and keep the victim comfortable until help arrives. Always get medical attention for all burns, especially those that are severe and those that cover large areas of the body. Unprotected exposure to hazardous materials can sicken or even kill a person. These are the basic first aid procedures for these exposures. For exposures to the eyes, flush with water for 15 minutes and get medical attention. For exposures to the skin, flush with water for 15 minutes and get medical attention for burns and other damage. For inhalation of vapors or gases, move the victim to fresh air immediately. Administer CPR if necessary. For ingestion, have a coworker call 911. Another employee can also call your local poison center for more first aid information. Then follow the first aid instructions in the Safety Data Sheet, SDS. The SDS is an excellent source of first aid information. Safety Data Sheets, SDSs, are located on Allied Oil's Shared Drive, Allied Lubricant Division, SDS folder, on our Allied Oil website, and within the ADAM software system. The rule for treating people who may have broken bones is never to move them unless it's just absolutely necessary for their safety. Neck and back injuries are especially risky. The wrong move could cause paralysis or even death. If you suspect broken bones, call for emergency medical assistance and instruct the victim not to move. Look for swelling and deformity. Ask the victim to rate the pain. Explain how the injury happened and if he or she can move the injured limb. Treat for shock if the person shows symptoms. If it seems that a person might have broken a bone, apply ice wrapped in a towel or cloth to the area and keep the victim comfortable until help arrives. Working in a hot environment or on a hot day can be very stressful for your body, especially if you're not used to the heat. Heat exhaustion may start out as discomfort and fatigue, but can quickly develop into something more serious. Symptoms of heat exhaustion include pale or flushed appearance, weakness, heavy sweating, headache, moist and clammy skin, dizziness, and sometimes nausea or a slight fever. First aid for heat exhaustion involves these steps. Move the victim to a cool place. Have the person lie down. Elevate feet 8 to 10 inches. Loosen clothing. Give the victim water and encourage him or her to drink slowly, and apply cool compresses to the head and body. Do not administer salt tablets, as these are a high blood pressure risk. If a person suffering from heat exhaustion is not treated promptly, it can turn into a heat stroke. Heat stroke is a life-threatening condition in which the body gets so hot that it cannot cool down. Signs of a heat stroke include very hot and dry skin, extreme tiredness, and confusion. You have to act fast in cases of heat stroke. Immediately dial 911. While you are waiting for help to arrive, cool the person down by hosing his or her body off with cool water or by fanning the body. Monitor the victim to make sure that the airway remains open, the person is breathing, and that the person has a pulse. If you work in a hot environment or if you exercise or work outdoors on hot days, you should recognize the symptoms of heat stroke and take precautions to prevent overheating. Fainting can occur when blood pools in the legs, reducing the blood flow to the brain. People may faint when they are standing for a long time in the heat. Fainting can also be brought on by stress. Check a person who has fainted for breathing. If the person is not breathing, begin CPR. If the person does not regain consciousness within a few minutes after fainting, call for emergency medical assistance and continue to monitor breathing. Otherwise, if the person quickly regains consciousness, have the person lie down with feet slightly elevated. Loosen any tight clothing, then allow the person to rest for 10 or 15 minutes until normal blood flow is restored and the person feels all right again. A person having an epileptic seizure may fall to the ground and have convulsions. If a person appears to be having a seizure, remove the victim from any dangerous objects or hazardous situations. Check for breathing. Do not put anything in the victim's mouth. And try to keep the person as comfortable as possible. Call for emergency and medical assistance if the seizure lasts for more than 5 minutes without signs of slowing down, if the person has trouble breathing afterwards, or if the person is in pain or other injury is present. Let's review briefly now with a multiple choice exercise. Choose the best answer, either A or B, to complete each statement on the screen. Which is the worst kind of burn? A, first degree, or B, third degree? Third-degree burns are very serious and can even be life-threatening. Call 911 immediately if you see signs of third-degree burns. Number 2, for a particle in the eye, you would A, flush with water, or B, rub your eye. For a particle in the eye, you should flush with water until the particle comes out. Never rub the eye. If the particle doesn't come out, cover the eye and seek medical attention. Number 3, for inhalation of vapors or gases, would you A, induce vomiting, or B, move to fresh air? For inhalation of vapors or gases, you need to get into fresh air right away. Number 4, for heat stroke, A, call 911, or B, don't call 911. For a heat stroke, call 911 immediately if you recognize symptoms of a heat stroke. A person can die from heat strokes. Now it's time to ask if you understand all the information presented in the previous slides. For example, do you understand what we've said about first aid procedures for eye injuries, burns, exposure to hazardous materials, broken bones, heat exhaustion and heat stroke, fainting, and epileptic seizures? Knowing about all these procedures will come in handy should you ever have to assist in a medical emergency involving one of these health problems. Let's continue to the next slide now and conclude the session with some key points to remember. Here are the main points to remember about basic first aid. Medical emergencies can happen anytime on the job. When a coworker is injured, you have to act quickly, calmly, and correctly. The best way to prepare for workplace medical emergencies is to be certified in first aid and CPR. This concludes the basic first aid for medical emergencies training session. Thank you for your time today and be safe.